911 emergency.
Yes, we have an emergency in the city of Mason. I believe it's at the corner of Main Street and...
minor damage on this female.
No, this is not Towlersville Road.
1717.
This is not Towlersville Road.
Was apparently non-restrained passenger in a vehicle. Unknown if she was in the front seat or the rear seat. Vehicle was on a remote winding road.
Suppose you were a trauma victim. The quality of care you receive during that first 60 minutes, that golden hour, can make the difference between life and death. If you reach a designated Georgia Trauma Center within that golden hour, you stand the best chance of survival.
A lot of factors determine this golden hour. What could delay it? How far is the patient from a trauma center? What time of day is it? Is there an aircraft available?
If the patient gets to the right place at the right time, the level 1 trauma center, the level 2 trauma center, you have minutes to assess and resuscitate that patient.
Unlike emergency rooms, trauma centers are specially equipped and staffed to treat severe, life-threatening injuries.
We are the only trauma center in about a 90-mile radius, so needless to say, we see everything. We have patients that are from infants all the way up to the elderly. We have patients that have every type of injury that you can think of: motor vehicle crashes, motorcycle crashes, gunshot wounds, stabbings, falls, and a number of other things that you wouldn't even think about.
Each year, nearly 50,000 Georgians suffer trauma injuries. Most of those injuries are caused by motor vehicle accidents and by falls. Yet only 1 out of 5 cases receives treatment at a designated Georgia Trauma Center.
I know as a paramedic, nothing makes me happier than I'm able to call a hospital, tell them the type of critical patient I have. When I walk into the emergency room, there's 4 or 5 doctors, 3 or 4 nurses standing by waiting on my trauma patient.
Designating a hospital as a trauma center is a costly commitment. The facility must first meet certain mandatory requirements, such as having special diagnostic equipment, an operating room on standby 24/7, as well as specially trained and certified staff.
It involves a whole cadre of specialists. It is surgeons who are specially trained, emergency medicine physicians who deal with trauma on a day-to-day basis. We have nurses who take trauma courses. They're specialized in this area. But we also have a lot of behind-the-scenes people who are part of the team. There are dedicated personnel there in place who deal with these type of patients on a daily basis.
Many of Georgia's hospitals, even those with excellent emergency facilities, simply can't afford the extra costs and challenges of operating a designated trauma center.
Some of the challenges are manpower. Having the nursing staff, having the physician staff available is a particular challenge for us. We see all sorts of patients from all walks of life, and some of those can't pay for their care, so we think it's a challenge to continue to provide the highest level of care when funding is a real issue for us.
Today, Georgia's trauma care is in crisis. Since 1990, the state's population has grown by more than 20%, yet the number of designated trauma centers has declined. Shrinking budgets and skyrocketing costs are stressing an already fragile healthcare system.
An established trauma network would mean access to excellent trauma care for all Georgians. Presently, there are pockets of excellent trauma care in Georgia, but there are areas that are devoid of any trauma system presently. What we would hope to do would be to bring all of the major elements of good trauma care to all areas of Georgia.
So, is supporting Georgia's trauma program worth it? The answer is yes. A well-designed trauma system with statewide coverage can save lives every day.
A trauma center is critical to the viability, growth, and functionality of any community. The system pays for itself many times over in taxes and revenue generated by those individuals that would have been lost to the community had they not been treated at that system.
A strong statewide trauma system would also benefit Georgia and its emergency response services in the event of a large-scale man-made or natural disaster.
Every community is vulnerable to a variety of hazards and potential emergency situations. Here in Georgia, public health emergency preparedness involves participants at all governmental levels, as well as cooperation with the private sector. An effective emergency response also includes emergency medical services and a strong trauma system component. To strengthen Georgia's homeland security, we must strengthen Georgia's trauma system.
Georgia has many of the tools in place for a first-class, comprehensive trauma system. We have some of the best trained EMS, rescue, and first responders in the nation. Our hospitals and their staffs offer quality care and service. Having a well-planned and funded trauma care system that draws on these resources is vital to our citizens and to our state.
It's a common misconception that the ordinary emergency room can provide excellent trauma care. Trauma involves resources beyond the average emergency room. We all wake up in the morning and leave our homes on our way to work without any assurance that if an accident happened, that we would receive excellent trauma care. An organized trauma network would give us that assurance and make us safe.
What would it take to create a trauma system for Georgia? The solution requires action on the part of policymakers. Long-term funding to develop an optimal trauma system is the key. Many states use innovative measures to support and expand their trauma systems, imposing impact fees on DUI convictions and moving traffic violations. For Georgia, improving trauma care isn't an expense, it's an investment, one that may be as little as pennies per day per citizen. That's a small price to pay to save lives.
We are at a critical point of necessity for trauma system development. The future holds some interesting things for us. What I think it holds is success in trauma system development. I fully believe that with the commitment of the stakeholders that we have, we will see a functional, integrated, statewide trauma system in the state of Georgia in the very near future.
Trauma in Georgia is a significant problem, and our state's trauma system needs further development. A call to action is needed to keep Georgia's trauma program off the critical list.